and the patients have a responsibility to not share their prescription. We let you know this because if you don't know about it, the world someday, I'm afraid to say, might not have molecules to save them, and we will all die. One of the pressing needs right now over the world is that of new medicines. There is a need for new drugs, especially new antimicrobials, and the question remains the same: how did we get here? How did we ever leave the era where there was abundance of antibiotics to the point where we do not even have useful antibiotics in the hospital? Those that are present in the hospitals, patients keep complaining they are no longer responding to treatment. They use them, there is this concept of resistance. The patients have developed resistance, the bacteria has developed resistance against these particular molecules that are present. And how did we get here remains a problem. And if we are not very careful with the way we use these life-saving molecules, someday there will be no molecule to save our life. And it started like this. It started as very simple. They prescribe you, yes, we prescribe you an antibiotic for 7 days for you to take it for a period of 7 days. You take first 3 days, 4 days, the 5th day, you feel better, you pass it, you stop treatment. And sometimes even take the remaining one and pass it to your friend, or pass it to your sister, pass it to your brother, and that way you're exposing the bacteria to suboptimal concentrations of that particular drug, and before you realize, that bacteria has developed resistance. It has learned how to survive in the presence of that particular drug, and that is when you start witnessing instances where the next time you suffer from that particular bacteria, they give you that particular molecule, it doesn't work again because the bacteria has learned how to do it. And this, ladies and gentlemen, let us stop the aspect of sharing antibiotics. Prescribers should take proper caution before prescribing. Do culture before prescribing. Prescribe antibiotics that are specific. Don't just prescribe broad spectrum antibiotics. Prescribe in an effort to preserve the little we have left. Let us be specific with what is prescribed to who, and the patients have a responsibility to not share their prescription. It is your prescription. It's not for you and your brother, or you and your husband, or you and your boyfriend. It is for you and for you alone. If your boyfriend or your husband or your wife needs their own, they should go and get it, because we want to fight against antimicrobial resistance. It is very necessary we let you know this, because if you don't know about it, the world someday, I'm afraid to say, might not have molecules to save them, and we will all die, not because God decided to wipe out the world, but because microbes have decided to revolt against humans and have overtaken everything, overthrown the human system, and we have nowhere to run to.